Hello, my friends. I'm Dr. Richard Miller. If you're watching this right now, I have a feeling something in your feet has been quietly nagging at you. Maybe it's that strange tingling that shows up right when you're trying to drift off to sleep. Maybe it's a patch of skin that stays rough no matter how much cream you rub in. Or perhaps it's a little cut or blister that just refuses to heal, lingering week after week. We've all been taught to wait for the big, loud symptoms before we worry: sudden weight loss, raging thirst, crushing fatigue. But after 20 years practicing medicine, I can tell you those loud alarms often come too late. Your body is far wiser than that. It starts whispering years earlier, and in my experience, those whispers very often begin in the feet. I'm a German-American doctor working right here in the United States, and I've made it my mission to translate what the body is trying to say before small problems become serious ones. Today, we're going to talk about 9 early warning signs that appear in your feet, signs that can show up long before any lab test turns red. I want this to feel like a conversation between friends. No heavy medical jargon, just clear, honest information you can actually use. Because if you're over 50, 60, or even 70, your feet are your freedom. They carry you to see your grandchildren, walk the golf course, travel with your spouse, or simply stand in the kitchen making Sunday dinner. When your feet struggle, life itself starts to shrink. But here's the good news. Catching these signs early can change everything. Let me tell you about a patient I'll never forget. His name was George, 67 years old, retired engineer, still playing golf 3 times a week. He came in for what he called a tune-up. While he was sitting on my exam table, I noticed he kept rubbing his ankles absent-mindedly. When I asked about it, he laughed and said, "Doc, my feet feel like they're wearing invisible socks. And these heels dry as the desert no matter what lotion my wife buys." He thought it was just old age. We ran a simple fasting glucose test. The result came back at 214. George had been walking around with undiagnosed type 2 diabetes for more than 2 years. His feet had been waving red flags the entire time, but he didn't know what to look for. That moment changed how I practice medicine. I decided I would never let another patient miss those early messages again. That's why I'm making this video longer than usual, because I want you to really understand this. I want you to walk away not just informed, but empowered. We're going to go deep into each of these 9 signs. I'll tell you what they feel like, what's happening inside your body, real stories from my clinic, and most importantly, what you can do about them starting today. The truth is, millions of Americans over 50 are living with pre-diabetes or full-blown diabetes and don't even know it. The CDC says over 38 million people in this country have diabetes, and another 97 million have pre-diabetes. That's almost half of all adults. Many of them feel pretty good. Their feet, however, are telling a different story. But please hear me. This is not a message of fear. This is a message of hope. Your body is incredibly resilient. When you catch these changes early and take action, sometimes as simple as better food choices, more movement, and working with your doctor, the trajectory can shift dramatically. I've seen patients reverse prediabetes. I've seen longtime diabetics dramatically improve their nerve health and circulation. You can be one of those people. So let's begin. The first sign many people notice is recurring numbness, or that annoying pins and needles feeling in the toes and feet. A lot of folks brush this off. I must have slept funny, or it's just poor circulation from getting older. But what's really happening is something called peripheral neuropathy. Think of your nerves as delicate electrical wires wrapped in a protective coating. When blood sugar stays too high for too long, that coating gets damaged. The signals start to misfire. What begins as occasional tingling can slowly become constant numbness. The toes are usually the first to speak because they're farthest from the heart. Your nerves there have the longest journey. I remember a woman named Margaret who came to me after her husband kept stepping on her feet while they danced. She couldn't feel it. That's when we discovered she had been diabetic for years without knowing. The good news is that when you catch neuropathy early, you can slow it down and sometimes even improve it. Here's a simple habit I want every one of you to start tonight. After your evening shower, sit down, put your feet up, and really look at them for 30 seconds. No phone, no television, just 30 seconds of attention. Notice any tingling, any areas that feel less sensitive. If it's happening regularly, tell your doctor. Ask for a simple blood sugar test. Don't wait until it spreads further up your legs. The second sign is one that keeps people up at night, literally burning foot pain that feels like your feet are on fire or being stabbed with hot needles. This is different from the tired ache after a long day on your feet. This pain often flares up when you're trying to rest. Patients describe it as electric shocks, burning coals, or walking on broken glass. This is painful diabetic neuropathy. The damaged nerves start sending wrong signals, pain signals, when there should be none. Research in the journal Diabetes Care has shown this is incredibly common, yet far too many people just reach for ibuprofen or arthritis cream and hope it goes away. If this sounds familiar, please stop masking the symptom and start investigating the cause. One practical thing you can do right now is pay close attention to your blood sugar after meals. Simple changes like adding more fiber-rich vegetables, eating protein first, and cutting back on refined carbohydrates can help stabilize those levels and give your nerves a chance to calm down. Stay well hydrated too. Dehydration makes everything worse. I've had patients tell me the burning was so bad they wanted to cry at 2 a.m. After working together on blood sugar control, many of them report the intensity dropping within weeks. Your nerves can heal, they just need the right environment. Third, and this one worries me the most when I see it in the exam room, are wounds, blisters, or sores that simply will not heal. You get a small cut from stepping on something in the yard, or a blister from new shoes. In a healthy person, that should close up in a matter of days. When blood sugar is high, healing slows dramatically. The tiny blood vessels that deliver oxygen and nutrients get damaged. The immune system doesn't work as efficiently. What should be a 3-day problem becomes a 3-week or 3-month nightmare. I cannot stress this enough. If you have diabetes or even pre-diabetes, every foot wound is serious. I've seen people lose toes because they waited too long. Don't wait. Clean the wound gently with mild soap and water, apply a proper dressing, keep pressure off it, and if it's not clearly improving in 48 hours, call your doctor or podiatrist immediately. Let me share something that might surprise you. Many of my older patients have told me they didn't want to bother the doctor with a tiny cut. My friends, that tiny cut can lead to a hospital stay. Be respectfully persistent with your healthcare team. You are your own best advocate. Number 4, skin discoloration around the ankles and lower legs. You might notice reddish brown or bluish patches that look like old bruises that never quite fade. This is often a sign that the small blood vessels in your legs are struggling, something we call vascular compromise. Imagine the blood vessels in your legs like a busy highway system. When they start to narrow or get damaged from years of high blood sugar, traffic slows down. The skin doesn't get enough oxygen and nutrients, so it changes color. People often mistake this for normal aging or sun damage, but when it forms a distinct pattern around the ankles, it's worth paying attention. A small daily habit that helps tremendously is gentle movement while you're doing other things. While your coffee is brewing in the morning, do 10 slow ankle circles in each direction and a few calf raises. These tiny movements encourage blood flow without exhausting you. Over time, they make a real difference. The 5th sign is one I hear about constantly: deep, persistent cracking in the heels. Patients tell me they've tried every expensive cream on the market and their heels still look like cracked desert earth. What's happening here is that the autonomic nerves, the ones that control automatic functions like sweating, are being affected. Your feet stop producing natural oils and moisture. The skin dries out, thickens, and cracks. These cracks aren't just ugly, they're doorways for infection. Bacteria love a nice deep fissure to set up house. If you're dealing with this, you need a thick, urea-based moisturizer applied twice daily. But here's my golden rule that I tell every single patient: never, ever put lotion between your toes. The skin there is thin and moist. Trapping lotion there creates the perfect environment for fungal infections, which are another complication we want to avoid. Now, before we move on to the next 4 signs, I want to slow down and speak directly to you. Take a breath. Look down at your feet right now if you can. Do any of these first 5 signs sound familiar? The nighttime tingling, the burning, the cracks that won't quit, the slow healing spots. If even one of them resonates with you, I want you to do something for me and for yourself. Drop the word checked in the comments below. Just that one word. It tells me you're taking this seriously. And it reminds everyone watching that they're not alone. We have a wonderful community here. And when you participate, you help other people feel brave enough to face their own symptoms. So go ahead. I'll wait. Thank you. I see those checked comments coming in, and it genuinely moves me. You're the reason I make these videos. Let's continue with sign number 6, swelling in the feet and ankles that leaves deep sock indentations. We call this pitting edema. Press your finger into the swollen area for a few seconds and it leaves a dent that takes a while to bounce back. While this can happen for many reasons, including heart or kidney issues, it's also very common when metabolic health is struggling. Your kidneys play a big role in fluid balance. When blood sugar has been high for years, they can start to have trouble. The result is fluid collecting in the lower parts of your body. Don't ignore this. Cut back on processed salt. Elevate your feet above heart level for 20 minutes every afternoon and get it checked. Your doctor may want to run some simple blood work to see how your kidneys are doing. Sign number 7 is sharp, shooting, electric nerve pain. Many of my patients have spent months or even years being treated for arthritis when what they actually had was nerve damage. This pain has a distinct quality. It's sharp, lightning-like, burning, or feels like an electric current running through your foot. It can come in sudden bursts that make you catch your breath. This is your nerves literally screaming because they're being damaged by excess glucose. The myelin sheath that protects them is breaking down. Stretching and massage helps some people, but if the pain keeps coming back with that electrical quality, it's time to look at blood sugar control as part of the solution. I've seen remarkable improvement in patients who combine good glucose management with the right medications and consistent movement. 8th on our list, cold feet that won't warm up. I'm not talking about the normal chilly toes we all get in winter. I'm talking about feet that feel like ice, even in the middle of summer, especially if one foot is noticeably colder than the other. This is often a sign of peripheral artery disease, or PAD. The larger blood vessels in your legs are narrowing, reducing blood flow. Your body is an amazing engineer. When one pathway gets blocked, it tries to build tiny detours called collateral vessels. The best way to encourage that process is consistent, gentle movement. A daily walk, even if it's just 10 to 15 minutes after dinner, can be incredibly powerful. I tell my patients to walk like they're late for a pleasant appointment, brisk enough to get the heart rate up a little, but still able to talk. And finally, the 9th sign that almost nobody thinks to check, loss of hair on the tops of the feet, toes, and lower legs. We don't usually think of leg hair as important, but it's a great indicator of blood flow. Hair follicles need good circulation to thrive. When blood flow drops because of diabetes or PAD, your body starts shutting down non-essential functions. Hair growth is one of the first to go. I've had men tell me they thought they were just getting smoother legs as they aged. But when I see shiny, hairless skin on the lower legs, along with some of these other signs, it tells me we need to investigate circulation thoroughly. Now that we've covered all 9 signs, I want to give you something practical you can use for the rest of your life. I call it the 1-minute foot check. Every single night after your shower or bath, before you put on lotion, take 60 seconds to examine both feet. Start at your toes. Look between them. Notice the color. Are they pale, bluish, or reddish? Feel the temperature. Is one foot colder? Run your hands over the tops and bottoms. Do you feel any numbness or unusual sensitivity? Check your heels for cracks. Look at your ankles for discoloration or swelling. Notice if any new hair loss has appeared. This 1-minute habit might be the most important thing you do for your health this year. Write down what you see. Keep a little notebook if you need to. Patterns matter. When you bring real observations to your doctor instead of vague complaints, you get better care. If you do notice any of these signs, here's exactly what I want you to say to your physician. Doctor, I've been experiencing numbness in my toes, burning at night, and my heels have deep cracks that won't heal. I'd like to be screened for diabetes and checked for circulation problems. Be specific. Bring your notes. You are not being difficult. You are being an excellent patient. I also want to talk about the bigger picture because I care about you having many more active, joyful years ahead. Your feet are connected to everything. Better blood sugar control helps your eyes, your heart, your brain, and yes, your feet. Simple daily choices add up. Choosing vegetables over chips, taking a walk after dinner instead of sitting right down, drinking water instead of sweet tea. These aren't dramatic changes, but they're powerful. Many of my older patients have told me they feel overwhelmed by all this information at first. That's normal. Start with the foot check. Master that. Then add one more healthy habit every week. Before you know it, you'll have built a strong foundation. I've seen 70-year-old patients start walking every day and regain feeling in their feet. I've watched people lower their A1C numbers dramatically through consistent small changes. Your body wants to heal. Sometimes it just needs the right support and a little time. If you have diabetes already, please know that proper foot care can prevent 85% of amputations. That statistic should give you hope, not fear. It means most serious problems are preventable when we pay attention. One more thing before we finish. If you're watching this with your spouse, I want you to do each other a favor. Promise to check each other's feet once a week. Many of my patients have reduced vision or flexibility and simply can't see the bottoms of their own feet anymore. Having someone who loves you help with this check can be a beautiful act of care. Thank you for spending this time with me. I know 25 minutes is a big commitment in today's world, but I wanted to give you everything I possibly could. You now have a complete framework for understanding what your feet have been trying to tell you. If this video helped you, please do two things. First, share it with at least one friend or family member over 50. You might literally save their feet, their mobility, or even their life. Second, if you haven't already, subscribe to the channel and hit the notification bell. We're building a community of people who refuse to let aging mean declining. We believe the later chapters of life can be some of the best ones. Remember, your body is always speaking to you. The feet just happen to be particularly loud because they carry your entire weight every single day. Learn to listen. Respond with love and attention. Take care of those precious feet, and they will continue carrying you to all the places and people you love. This is Dr. Richard Miller. Thank you for being part of this journey. I'll see you in the next video, my friend. Until then, keep moving, keep learning, and above all, keep listening to what your body is telling you. God bless you.